Columbus health officials have issued a warning about a syphilis outbreak, urging at-risk individuals to undergo testing and seek treatment if needed. Today on City Chat. Joining us today is Dr. Mysheika Roberts, the Columbus Public Health Commissioner, here to provide our health update. Thank you, Dr. Roberts, for coming here today to talk about this syphilis outbreak and what we can do to prevent it.
Glad to be here.
Can we first start out with just understanding what syphilis is and who it affects?
Sure. So syphilis is a sexually transmitted infection. The good thing is it's a bacterial infection, meaning it does respond to antibiotics, and there are effective antibiotics out there. So individuals who are sexually active, particularly those who are having sex without protection or have multiple sex partners, are at risk for syphilis. There's multiple stages of syphilis. There's primary, secondary, and tertiary syphilis. Again, all of these stages can be treated, and you can go from primary, which is usually a sore, or what we call a chancre, in your genital area for a man or a woman. That sore can go away without treatment, and then it can progress then to the secondary phase, which is usually a rash you see on the palms of your hands and the soles of your feet, as well as other places on your body. That rash, as you can imagine, can look different depending on your skin complexion. Obviously, if you don't get treated for syphilis at that point, if you're not diagnosed, it can then progress to neurosyphilis, which is very dangerous, and we don't want to see that happen.
So for a person who is sexually active or has multiple partners, you know, they see this sore and it's painless, it just goes away. Would you advise them to go ahead and make an appointment to check it out, or?
Absolutely. So the good news about syphilis is you can have no signs and symptoms of syphilis, but you can get a blood test done, and we can diagnose it that way. So that's the good news. It's not like you have to have the sore or you have to have the rash. Right. So my recommendation are that individuals who are sexually active, particularly if you have many sex partners and you're not using protection, is that you get tested or screened at least once a year and probably twice a year.
Yeah, because if they don't, then this kind of could just like sneak up. It sounds like this particular STD kind of just like sneaks up on you.
Well, yeah, you can say it sneaks up on you, but I think people mistake it for a lot of other things and dismiss it and not think it's a sexually transmitted infection.
What is the third phase when you have neuropathy?
Yeah, neurosyphilis. So that's when it gets into your spinal cord or your brain. You can have weakness in your legs. You can have symptoms that mimic a stroke. You can have vision problems, as far as blindness even. And that's a very late stage of syphilis. We don't see a lot of that here in our community or really in our country, but it does occur. That's why we encourage people, particularly who are at risk, who are having multiple sex partners, not using protection, to have an annual, if not a biannual screen.
And so can we talk a little bit about how, you know, Columbus health officials, you know, you guys issued this warning for, you guys saw like a really big increase since COVID. And can we talk a little bit about the yeah.
So a lot of things changed during the pandemic, right? And so what we saw was from 2020 to 2021, the number of syphilis cases here in Franklin County doubled, which is really concerning because we had about 700 cases a year in 2020, which was slightly up from 2019. But then in 2021, that went up to 1,500 cases. So a lot of cases. And then in 2022, that went up even higher. It didn't double, but it went up even higher. But what's been most concerning about the increase in cases is we're seeing more cases in pregnant women. And these are pregnant women who are not seeking prenatal care for a variety of reasons. And what's concerning is if you're pregnant, you don't get tested and treated for syphilis, you can pass this infection on to your child. And that can cause prematurity, so your child could be born early. Your child could have brittle bones. And so one of the things we do when we diagnose a baby with congenital syphilis is we do a full body x-ray to see what their bones look like. But your child can even have blindness, and so that's concerning too.
What is, does syphilis, can we talk a little bit about the treatment and cure if you are diagnosed?
Sure. Well, the treatment is there and it's readily available. The preferred treatment is bicillin, which is a fancy name for penicillin. Okay. It's actually one of the original antibiotics that we've had. Okay. It's been around for a long time, so it's very safe and effective. You do administer penicillin or bicillin to patients with syphilis via a needle. So it's an injection that individuals get. But it's very effective and it can cure syphilis. For those individuals who are allergic to penicillin, we can give them an oral antibiotic called doxycycline. That is readily available and affordable. And if someone absolutely needs penicillin but is allergic to penicillin, we can even go as far as desensitizing them to penicillin, getting them in with an allergist who can gradually expose them to the bicillin to make sure they don't have an allergic reaction to bicillin.
That's so encouraging, you know, like it sounds so dooming what viruses and can do to somebody, but then there's a cure.
There's a cure that's been very effective and is readily available. There was a time, most recently, where there was a shortage of bicillin, but we are seeing a more plentiful supply now of it in our community.
In your opinion, the rise of syphilis during COVID, is that the actual, do you think it's like culture that has made it this way, or is it the actual virus, you know, because of COVID and everybody?
So I want to be clear that syphilis is a bacteria, it's not a virus. Okay. So the difference is bacteria can be treated and cured. Viruses, you can only treat the symptoms, you can't necessarily cure them from the virus. So okay. I just want to be clear about that. So I think that what we saw as a result of the pandemic was a few different things. It was like the perfect storm, right? Mm-hmm. People were shut in, they were had limited contact with people, and then when they were able to have contact with people, they might have gotten overly excited and done more than they had been doing pre-pandemic. Right. Then we also know that sometimes getting into healthcare during the height of the pandemic was a challenge. I can speak for our clinic at the health department. We had to limit the hours of some of our services. And so it wasn't easy for people to get in and get diagnosed and thus get treated. So I think that further exacerbated the situation. And then, like so many things in our community that have gotten worse during the pandemic, we saw more drug use during the pandemic. And so I think all of those things combined lead us to what we're seeing in terms of the numbers of syphilis cases in our community.
Thank you for that. What would be the main messaging of Columbus Public Health regarding STDs and syphilis?
So I would say that if you're sexually active, you have multiple sex partners, you should be getting tested for all STIs, including syphilis, at least once a year, if not twice a year. People who are at greater risk or where we see a larger number of individuals with syphilis are men who have sex with men, young African American men, and people who are doing drugs. And so I would encourage individuals, if you're in one of those categories, you should definitely be screened at least twice a year.
I'm Josie Smith. Thanks for watching City Chat on CTV.